and I'm the Chief Executive Officer of the Mental Health Association. If you're here today in this room or on the Zoom, or perhaps participating in the social media broadcast, you're probably aware that last night approximately 1.8 million Americans were incarcerated in our jails and prisons throughout the United States. 40% of those individuals had some type of mental health diagnosis or a substance abuse diagnosis. About 16% of those individuals, or approximately 288,000, have a severe and persistent mental illness. Right, so reasonable people can argue as to whether they should be there or not, but the fact is they're all even. All right, and just as context, that 288,000 individuals is 10 times as many people that are currently hospitalized in long-term psychiatric hospitals. So, as you know, our correction system has become, welcome, prosecutor. Hey, it's good to see you. Welcome. Absolutely. Absolutely. So, as you know, our jails and prisons have become the largest overnight caregiver of individuals with severe and persistent mental illness, some of our most vulnerable citizens. I think we can all agree that that's wrong. Fortunately, here in Morris and Essex County and throughout the district, we have an array of local officials who take this issue seriously, and our local leaders on this issue. And our moderator this afternoon, who I'll introduce shortly, is now providing national leadership, which we are grateful for. So I will start with introducing the members of the panel. Deanna Ackerman, who works for the Mental Health Association, works at our Collaborative Justice Services Program. Chief Caggiano?
You got it.
Caggiano.
Caggiano, thank you. Mineville Police Department, welcome. Rachel Haley, who also works for our Criminal Justice Reform Program in Essex County. Essex County Prosecutor Ted Stevens, welcome, sir. Former board member of the Mental Health Association, and a gentleman I've known for so long, I don't remember how I met him, Armando Fanturo. Chief Spango, also the mayor of Roseland. Med Rodriguez, Morris County Prosecutor's Office, and Kerry Totten, Morris County Prosecutor's Office. Now, for me to appropriately introduce Congresswoman Mikie Sherrill would take about 20 minutes, given all her accomplishments, but we don't have time for that. All I will say is she is not new to this space. It is something she is very familiar with. In fact, has an assistant U.S. attorney prior to being a congresswoman for the 11th district, has an assistant U.S. attorney. She was responsible for the outreach and reentry programs that the federal government ran in New Jersey. So many elected officials, frankly, in my experience, ignore this issue. Congresswoman Sherrill has chosen not to ignore the issue. And furthermore, she has chosen to lean in because it's the right thing to do. With no further ado, our moderator, Congresswoman Mikie Sherrill.
Well, thank you. And this, this is something that's near and dear to my heart. As you've heard, I helped start the District of New Jersey, which was the U.S. Attorney's Office for the state, start the first federal prisoner reentry program. And as you delve into those issues, you learned so much. And I'll never forget listening to a radio program about the Cook County person in charge of the prison system in Cook County. That's where Chicago is. And her background was in training as a psychologist. And the person interviewing her said, well, does that make sense for you to be like a psychologist if you're the head of the prison system here in Cook County, one of the largest prison systems in our nation? And she said, yes, it makes perfect sense because we actually house more people with mental health problems than people in the mental health system. And then, take that. And then you also, I remember speaking several years ago to a police officer, and this wasn't, this wasn't something that I think he'd garnered from any research he'd done. It was just sort of his gut instinct. He said, I feel like if you have an untreated mental health problem, there's about a 90% chance you're going to come in contact with our criminal justice system. And often you're going to end up incarcerated. And that's not the outcome we want, right? It's unsafe for our communities. It's unsafe for our police officers. And it's certainly heartbreaking for people who suffer from mental health issues and aren't getting the care they need, as well as for their families who often don't know what to do. In fact, someone who has been just sort of working on this issue for his entire life. It comes out of the fact that his sister had mental health issues that the family could just never figure out how to appropriately get the help they needed. So that's why we're all here today, because we know we can do better. And what I love about New Jersey is we bring everyone together. It's not a fight over whose fault it is or who's not doing well. This is really congruence of the community, the mental health community coming together with the law enforcement community, because we're always looking to do better policing. We're always looking to take care of our citizens better. And it's something I hear over and over again. And it's especially important, I think, as we kick off National Police Week today. So thank you, everyone. I just want to add a few additions to our wonderful panelists here. We also have the Morris Plains Chief Michael Koreski, who is the president of the Morris County Police Chiefs Association. Livingston Chief Gary Marshitz, who is here and has had the dubious honor of housing us at our office in Livingston. The Mountain Lakes Chief Sean Bennett. There you go. Thank you. And thank you for your work at the other night at an event we had. Everyone was incredibly professional. The Madison Chief John Misha, the Chatham Township Police Lieutenant Brad Hayworth, Montclair Police Sergeant Michael Luzzi, and the Orange Police Detective and Board Member of MHA Ingrid Lotz. Have I forgotten anyone? Everyone in the room. Well, thank you all so much for everything you do. I know how understaffed our police departments are. I know how busy you all are. So to have all of you here, I really do appreciate. And I also want to thank the staff and board members of MHA who are joining us in the audience for your critical work. And especially given our topic today, Diana Riccioli. Riccioli, I felt so good about it.
We're a good team, but somebody.
As somebody who has spent her life getting called Mikie, I really try to do better. For your work as a forensic psychiatrist with decades of experience working in jails, prisons, and hospitals. As your Congresswoman, I'm constantly working on trying to make New Jersey a better place to live. And part of my public safety agenda, which now includes the bill I'm introducing today, and that is the Improving Mental Health Care in the Reentry System Act. And as with so many of our public safety bills, it comes out of discussions with our law enforcement community and people in public safety. So this is truly, I think, going to be very helpful. I'll tell you that we started the District of New Jersey's first federal prisoner reentry program. And what we were looking to do was to increase access to healthcare services, to job training, to transportation services, et cetera, to get people reentered in the community. I had the pleasure of going back to the graduation a couple of years ago. And the thing, you know, as I was talking to Judge Arleo, who leaves the court, the thing that had become so instrumental in their services was actually a mental health component. It's truly what we were missing, is that mental health trauma, the trauma that prison brings, the trauma that many of our people who become incarcerated have brought with them from family situations and other things. It's so important to address that, or you're just not going to have the great outcomes that you want. So we're trying to handle this on so many different levels. And that's why, while it's not strictly a public safety bill, I do have a high impact tutoring in K through 12 bill to address pandemic related learning loss, because we know that poor academic achievement can lead to higher longer term crime and incarceration rates to get everyone back on the track. It's why I'm such a proponent of making sure that we have good Head Start programs, good early child care development programs. Again, when I was in the reentry space, when I asked what we could do to break that school to prison pipeline, thinking it would be after school basketball programs in high school, the woman who had studied this for years said, it's Head Start. She said, you would be amazed at what a return on investment we get for great early childhood learning. So finally, we're here today for the Improving Mental Health Care and the Reentry System Act. It's going to really help us do just that. It will create grant programs through the Department of Justice for prisons and jails to expand access to high quality mental health care that will help justice involved individuals to succeed after their release. First, the grant program would create a mental health screening process for individuals as they enter jail or prison. If they are found to be in need of treatment, the facility receiving the grant would be required to ensure the individual is referred to a mental health care provider either during their sentence or immediately after their release. And second, the bill would also help prisons and jails hire a full-time mental health liaison that would work with regional mental health care providers to help coordinate the proper care for individuals. And finally, this legislation would fund research so we can evaluate the success of these types of programs and work with members of the community to make sure that resources are being used in the most effective way. I believe strongly in legislation that is evidence-based. So drafting the legislation, we focused on an innovative pilot program within the jail system of Johnson County, Kansas, which developed a similar type of mental health survey and referral program in 2016. The results have been dramatic. Access to mental health care among recently released individuals increased by 27 percentage points, and one-year recidivism rates fell by 16%. So my office worked with many of our local mental health professionals, as well as state and local police officers to come up with a bill that would directly address the needs of our community. So I'm grateful my bill has the endorsement of the MHA as well as the Sheriff's Association of New Jersey. And we're so fortunate to have MHA already offering collaborative justice services in partnership with Morris and Essex counties to provide this type of reentry mental health support here in New Jersey. So as you just heard from Bob, we have some incredible advocates and experts on these programs joining us today. So first, I want to turn to Prosecutor Stevens. This is your punishment for arriving late. Thank you so much. He's never going to come to an event again.
I'm never going to live this down.
So thank you so much for joining us. Can you share a bit about some of the problems we're seeing with crime in the community and tell us what Essex County is doing to try to improve public safety through programs that give young people opportunities and support people transitioning back into our community?
Sure. And thank you, Congresswoman. Despite my lateness today, I'm extremely excited.
Well, we're very happy.
And I try to be supportive of the Congresswoman. She does great work for Essex and especially for the law enforcement community in New Jersey. So we're pleased to support you any way we can. Specifically, crime in Essex County has always been an issue for a number of years. The Essex County Prosecutor's Office is one of 21 prosecutors' offices in New Jersey. Yet we have the dubious distinction of having between a quarter and a third or a half, depending on what day it is, of the violent crime in the entire state. So let's look at the low end, 25% of violent crime in one county as opposed to 21 counties. So those issues are near and dear to our heart, and anything we can do to one, lessen the number of criminals who we deal with, but also to make sure that justice is meted out. And I think that you were describing your bill. It sounds like it's a justice bill to me, one where individuals who should not be in the criminal justice system are diverted to the proper professionals they need to really help them get their life back on track. With me today is Gwendolyn Williams, who is the Executive Assistant Prosecutor for the Essex County Prosecutor's Office. And Gwen's presence here is so important because for the last 16 years, she has run really probably the most robust mental health diversion program in New Jersey out of Essex County. I say that because one, we've got great results coming out of that. And fortunately, we were working with Senator Teresa Ruiz and her office early in the year, and we're successful in getting a statewide bill passed for mental health diversion programs. And I'm happy to say it's modeled on basically what we're doing here in Essex County. So we're extremely pleased. So that's an issue that's near and dear to our heart. Also, I've had the pleasure working with Bob in the last 3 years, and Bob, through the efforts in West Orange, have been successful in putting together really the first mental health diversion program, kind of really a precursor to the AG's Arrive Together program in West Orange. And so obviously the AG is very concerned about that as well. So anything we can do to stop recidivism, which is really what it's all about in terms of justice, and individuals who are only system involved because of a mental health disorder, we need to identify that early on. And sometimes the only time to do that is when they hit the jail. That's the first opportunity where someone who is of authority and of means can actually start to identify that and deal with it. The jail in Essex County does have a similar program that is in operation now. They have a questionnaire that they give to individuals. And then if a problem is perceived, they direct the person to a nurse that's on staff and then to a psychiatrist if in fact that is where it needs to go. So clearly this is the forefront of where we need to go with criminal justice, being able to identify individuals who need not be system involved criminally, but have an identified a diagnosed problem that can be met and dealt with in a medical fashion. So that's what's happening here in Essex and just the tip of the iceberg in terms of where we are going forward. And so I think that this was certainly something that's right down our main drag, and we're happy to help.
Wow. You know, I was so impressed to hear you talk about the term justice, because I think all of us who've worked in public safety have that as just a core value. And there's nothing that feels better when you could deliver justice and have a good result that you believe in. And there's nothing worse when you have to handle a situation when you feel there is no good result and you're just doing your best with several bad results. And so I think in the area of mental health, that's where many of us feel these tough choices most strongly. And so ideally, we would have a situation where in our society, we have other ways of handling mental health, but you're right. Many of the times, the first time we get to engage on this issue in a helpful way is when people do come to our prisons. And so I'm so glad to have Meg Rodriguez and Carrie Totten here to talk about the mental health work at the Diversion and General Investigations units of the Morris County Prosecutor's Office. So Meg and Carrie, can you share some of the work you're doing to integrate mental health support into diversion and reentry programs, and how those programs help overall public safety in the community, and why federal support is so important?
Thank you, and we greatly appreciate being part of the conversation and for all the support that you are giving on the federal level. I do agree with Prosecutor Stevens as far as we tend to identify a number of individuals who are suffering from mental illness when they hit the jail. What we're trying to do here in Morris County is to try to identify them even before that with any type of interaction that we wind up having. Law enforcement is often tasked with not only having to respond to burglaries, to car thefts, to homicides, to car accidents. Oftentimes, they are the recipients of that 911 call that involves a mental health issue. When a family is frustrated, they don't know what to do with their family member. So what we have done in Morris County, we're fortunate to collaborate not only with MHA, but with the Morris County Sheriff, Jim Gannon, and with other agencies, including the AG's office. We're trying to identify things before it even gets to the jail. We do that, one, through our Arrive program that we're recently getting up to speed. And we work directly with Deanna and MHA for that program. We have several of our towns, some of the chiefs here are involved with that. We're hoping to expand throughout the county. And our program has, when officers get a call for an emotionally disturbed person, whether it is potentially suicidal, whether they're acting erratically, usually law enforcement would go out and try to figure that out, but they're not clinicians. So we do have a partial co-response program. We're close in time response for 8 towns right now in Morris County, that when we get that kind of call, a clinician from MHA will go respond at the same time as law enforcement. But if they're not available, law enforcement is going to continue just to respond the way that they would to try to get that person to help without having to escalate to a level that either it's going to result in use of force or it's going to result in any type of criminal charges. And they are then going to refer the case to MHA for follow-up work. Because that is oftentimes what is really missing is you get people that continue to have issues and they're not being addressed. So what we're doing now with MHA is with that follow-up program through Arrive, they will have somebody contact that individual as soon as possible and make sure that they are connected to the appropriate services. So that's one thing that we're trying to do so they don't have to hit the jail. The second thing that we're doing is really leaning in heavily on our crisis intervention team training for law enforcement and building the teams, if you will, with law enforcement and mental health professionals. We just finished our 10th class here in Morris County. It was a week-long training. It's 40 hours. It does tend to get a little intense. But by the end of it, when people walk out of it, they have realized there are so many services here in Morris County that they didn't even realize existed. And it gives them more tools to be able to refer to individuals who are suffering from anything from schizophrenia to bipolar to Alzheimer's to postpartum depression. So that we give law enforcement the tools and also introduce non-law enforcement, such as we had DCP&P workers, we had various agencies, Homeless Solutions, to know how to contact law enforcement and how to work together when we're dealing with the same issue, really. So that's the initial part of what we do. But of course, they wind up coming to the jail for various reasons. And as a result, the third part of diversion is recognizing when somebody has a mental illness that it has a nexus to the crime that has been committed. What can we do to help them? Because we don't want them coming back. If we can possibly intervene, get them the help they need, the goal is to not have them come back and commit any more offenses. So we have expanded our mental health program. It had been in existence for about 12 years and led by Assistant Prosecutor LaJuan Tucker. And at that point, once we recognized that somebody had a mental illness that had nexus to the crime that had been committed, we sought to get them help. We sought to preclude them, to divert them from going to state prison and put them on probation and get them the help that they need. Under Prosecutor Robert Carroll, we have since expanded our program to a full diversion program where if somebody is legally appropriate, clinically appropriate, and case management appropriate, we review those cases, and if they are appropriate in that sense, they may be able to have their charges dismissed after they engage in a term of probation, where we give them all wraparound services. That's something we work on with Deanna and MHA, along with our judiciary. We have a special probation officer who supervises those cases to make sure that, again, they get the help that they need because we don't want them coming back. And obviously it is a big factor for people who come through the system to not have criminal charges in the end, to preclude them from having a criminal record if possible, because that's only going to help them going down the line.
That's great. I think, the combination of the Arrive Together programs and helping have some clinicians on site to handle really difficult mental health scenarios. But also when you talk to people in reentry, I've often felt like we are underutilizing that prison time, that you have a captive audience.
Right.
And people sometimes away from some of the triggering events. So if you can delve into those things in the prison, it's so helpful. Thank you. I know you all work closely with the Mental Health Association of Essex and Morris to carry out these programs. I've had the real pleasure working with MHA since I've been in the office. We use them as sort of our consults as we get calls into the office that are outside our area of expertise as members of congressional staff. And they have been so incredibly helpful and impactful. So we're lucky to have Deanna Ackerman, who heads up MHA's reentry work in Morris, and Rachel Haley, who runs the Essex County program, here with us. Can you each share a bit about how collaborative justice services operates in your respective counties, what sorts of programs you've seen to be most successful, and what further federal resources or programming would be the most beneficial to your mission?
Sure, I guess I'll go first, following Meg. So in Morris County, we have Collaborative Justice Services, which is also known as CJS here in the county. There's two components of this program. One is the reentry component. That's when we work with the Morris County Correctional Facility, community providers, as well as the judiciary to perform reentry services. So that comes in the form of case management. So we're meeting with individuals in the jail system prior to or completion at their sentence. So we're developing a service plan before release. So once they are in the community, we can link and refer them to the necessary services, whether it's housing, mental health treatment, financial income, you name it, we kind of do it all here. And then from there, we monitor those linkages to ensure their stability in the community, reduce recidivism. So that's kind of that program in a nutshell. The other program is the diversion. Meg covered a significant portion of it. And in that program, we have fully licensed clinicians, as well as peer support specialists and case managers. So we work directly with Morris County Probation and the prosecutor's office to provide a lot of the same services we do with reentry as far as case management is, but also that clinical component too. In that program, we're really looking for the nexus between their mental health and their criminogenic behaviors and providing the education and the tools for them to be successful in the community. As far as successful programs that I've seen, I would have to say the Hope One van through the Morris County Sheriff's Department. They have such unique services. One I can think of is their identification program. As you all know, it's very hard to access information and services if you don't have basic needs like an ID. So the program is there for individuals coming out, which has been extremely successful. Another is CIT and Arrive, as Meg had stated. This program is really giving law enforcement the resources that they didn't have access to prior, really reducing number of arrests, involuntary hospitalizations, use of force, and ultimately reduction in recidivism. So that's what I have to offer. Rachel's up next.
Yeah, so the Criminal Justice Reform Program in Essex County offers wraparound services. Essentially, we have staff that offer the pre-screenings, we call it the social determinants of health tool, to individuals who are on pre-trial before they go up for central judiciary processing court. And then when they're out, we immediately have an appointment with them in our office where we offer counseling, peer support, we have peer group, we have case management. So they get treatment, but we can also link to treatment within mental health association and in the community if necessary. And the one thing I want to say is that 93% of individuals who enter into our program don't get reincarcerated while they're in the program. So I think learning those vital coping skills and also getting linked to needed services changes their lives completely. Some of the successes I would say is building relationships with the municipal courts because we focus on 3rd and 4th degree charges. So because of that, most of their cases within Essex County get downgraded to municipal court. But also they need that warm hand to guide them through the system. So we assist them in every aspect of that. And they have an entire team behind them, whereas if they weren't in the program, they would be doing it alone. One example is we had a woman come into our program and she was pregnant, dealing with domestic violence. And she was able to completely change things around, get housing, get support for her daughter when she was born, navigate through the criminal justice system, and was able to stay out of system that entire time. So that's just an example of what we can do. And I would say, like, as far as I would want to expand and do more, because Essex County is a large county. So being able to just do more of what we're doing and building those relationships and collaborating with people in the county would be great.
Well, thank you both. That's wonderful. Next, I'm going to turn to Sheriff Ventura and Chief Spango. The mental health of our law enforcement officers is also incredibly important. The profession requires a lot of those who serve. I was really so impressed when I went to see our Navy SEALs, who, when I was in years ago in the Navy, mental health was sort of one of those things where you try to not report it. You didn't want it on your record because that could impact your future. You'd advise people. I even advise people at times, I'm ashamed to say, go see your clergyman, because that wouldn't be on your history. But now I went to one of our SEAL team programs, and the commanding officer of the SEAL team said that, you know, he goes to get mental health support. He tells the people who work for him about that and then checks in on them, making their mental health appointments. It's become a requirement after certain jobs that you do. And so I thought that modeling of somebody who was seen as a leader in the community of seeking mental health support was so important. I'd love to hear about the mental health support people have, the structures you have in place to support it in your officers. In addition, for those who are incarcerated, this issue also has a huge effect on their families. So what programs are out there to support the mental health of family members of those who are incarcerated? So officers and then family members of incarcerated people.
Well, we have an order of a policy in place, a protocol in place for when officers, which is quite often the prosecutors point out that our jail is the largest jail in the state of New Jersey. We average over 2,000 inmates on a regular basis, on a daily basis. So it gives you an idea what kind of volume that we have. And of course, the contact that are also coming in with the community while they're doing their job can be extremely stressful, and at times using force that they're reluctant to use, but they have to use. So we have a protocol in place that the chief has an order right here that we put together. You want to talk about that a little bit?
A couple of years
Then
ago,
I'll come back and talk about something else. Go ahead.
the sheriff tasked us with coming up with an order for officers that are involved in critical incidents. And it's a policy that the sheriff implemented, that when the officers, there's a whole list of elements, anytime an officer comes in contact with certain things, from shootings to, you know, something that might be traumatic that's dealing with a child. There's a system in place that officer is given immediate, after the incident is over, mental health screening with our county hospital, as well as a policy and program that's in place to monitor the officer going forward from their own frontline supervisor, what to look out for, how to monitor this, what are red flags. And then if it rises to that level, that officer gets pushed to psychological counseling. But the entire time this is going on, it's all done anonymously for the officer, because what we have in law enforcement is officers are sometimes afraid to ask for help, and their mental health has to be monitored, because exposure to traumatic events for an officer on a daily basis, of course, can build up and have underlying issues that the officer doesn't even realize is going on. That affects not only the officer, but also affects the officer's family. The sheriff also, as I'm sure all the law enforcement in here knows, the Handle with Care Act that we have to deal with, where anytime a child is involved in a traumatic experience, letting their school know. You know, when we as law enforcement go in and make an arrest or have to take father or mother, brother or sister out of that family for whatever reason, it's a traumatic event for that 5 or 6 year old child or that spouse or that brother, to make sure that they get the proper care they need, because they're also being exposed to the traumatic event of that member of the family, loved one, guardian being removed from that family unit.
You know, back in when we had a police director in Newark, when I was in Newark, related to Glenn Williams, Heward Williams, and we recognized the problem the chief just talked about for our own officers, but also the mental health system as applied to folks that we were dealing with on a regular basis. So I suggested at that time, I think I was a young lieutenant, and I suggested to the police director at the time, we were very close, that we might go to a mental health organization and see if we can somehow try to address that. So I scheduled a meeting between him and her and the mental health people at that time up in East Orange. And somehow immediately after that, I became assigned to the Mental Health Association.
You're welcome.
Thank you. But it was just at the beginning that we recognized that there was a problem. And, you know, we tried to address it and deal with it, but it was kind of overwhelming, as it still is for all of us. I read the copy of your proposed bill, and you know, you talk about the when somebody's on the way to the entering the system, that would be the time that we should. I would like to suggest that perhaps you want to go a little bit before that perhaps at arrest time. You know, because at the arrest, the officer will recognize that there's that individual, if we recognize that he or she may have a problem, they may be well released before they actually
Yeah.
go into the jail, you know?
I think,
They could get bail or we can summon them out, right, and they could be gone before and still have that same problem, so, you know.
Well, Sheriff, I heard you're retiring. I think you're gonna have time on your hands.
I think what we've learned is we need to be prepared to intervene at all points. Whether it's prior to arrest, at arrest, after arrest, at all points, including upon reentry.
I think that's exactly right. And Carrie, did you have more to add, though? I kind of glossed over. I agree on a little too quick.
I could just explain a little bit about the process. When someone applies to our program, the application consists of mental health diversion, mental health probation, and our veterans diversion program. And we have had, and I know this is near and dear to your heart, Congresswoman, we have had veterans who apply to our program who reside out of county, so therefore they're ineligible, but yet they still have a serious and persistent mental illness and a nexus to the crime. So then we accept them into our mental health track. So there's different ways we can work within the confines of our program. And I think Meg did explain the collaboration between MHA, which is fantastic, and the probation officers, and also the court. Morris County Superior Court Judge Hubner holds our wellness reviews on a monthly basis. And that has just been a fantastic component of this program, because between our weekly team meetings of all the partners that collaborate, MHA, prosecutor's office, probation, and our public defender's office, as far as with participants who are in the program, the head of the public defender, Sue McCoy, she's also there. And if someone is having an issue, we discuss how we can guide them and help them through that. And then they come before the court, and Judge Hubner offers that additional support and guidance. And it's a very different environment than one is typically used to in Superior Court. And that really helps that successful track of the program. And we've gotten so much positive feedback, and we even have individuals who maybe they weren't scheduled that month, but they contact us and say, no, I want to be there. I want to tell the court this.
Yeah.
So it goes to show, to me, that's a testimony that people do feel comfortable, they want to be there, and they know that they have people around them who are keeping them accountable and who support them.
Yeah.
And if they fail, that we're there to pick them back up,
They have a
you
safety
know?
net.
Yes.
No, it's so important. And I think what's really hard with mental health is it's hard to, you break your arm, you have a cast, everyone knows you broke your arm. Mental
Right.
health, it's kind of sometimes an invisible wound, and we're seeing
Right.
that as we deal with some of the struggles that our veterans have with traumatic brain injuries. It's not visible. How do you make this more structured so it's understood? Yes, you've been injured, or you've been facing something that's traumatic. And I love the idea of pushing into the system, not saying, because look, we've all dealt with like tough guys. Some of you guys know tough guys, right? Like the idea that you're just gonna say, here's all the mental health services, take advantage when you want it. It is not necessarily how that population works. It's much better to say, check in, because I think, for example, so many people who've suffered, again, I come from the background of the military, and so many people who've come from the back, had PTSD, they don't see they're struggling with it until later. And they look back and they say, this was what I was doing because I was suffering from that. But at the time, they didn't really see the need for help until afterwards. And we know with our public safety officers that, they don't get I don't want to say our military gets a break, but you can go off to your combat position, then you can come home to sort of have at least some stability. But a law enforcement job is pressure, relentlessly.
And to that point, Congresswoman, and that of Sheriff Montour as well, that early intervention, we're saying the jail is a point, but even prior to that as well. And I think we have the benefit of having Gwendolyn Williams here today, who runs our intervention program, CIT and the like. And with your permission, she might give a little insight in terms of what the benefits of that we've seen in terms of interactive rating. Sit up here, but sit up.
wanted to be your backup. But, okay, we do very similar things, Morris County and Essex County, and we've collaborated on some of the ideas over the years, what we do. But we do the Arrive Together program, as well as we have our Veterans Diversion Program as part of our mental health program, only because the way the law is currently written in the state of New Jersey, the bulk of the veterans who apply do not meet that criteria because they're usually charged with a weapons offense. So in our mental health program, we are able to take them in. What we do in Essex County that's a little bit different from some of the other counties is that we do look at second-degree offenses, and on a case-by-case basis, we will determine whether or not that person is eligible for our program. And when I say that on a case-by-case basis, I like a restorative approach to justice where we bring the entire community in terms of the victim. I'm very victim oriented. Many times the victims in these cases are family members, and we look at the impact it has on them and that their cooperation with them, with their loved one being in the program, because where are they going to go? They're going to go back home, or they're going to go back into the community. So we want our community input as well. So we are very, very strongly for that part of restorative justice to make sure it is a collaborative approach. Of course, Mental Health Association, we have worked with them as well for their input and insight in terms of the types of additional assistance that they will have. We're fortunate in Essex County in that we do have a county hospital psychiatric center that are our lead, that under Carolyn Murray, who first initiated this program when she was the acting Essex County prosecutor, she contracted with them, and we currently have that contract. Now, what I would like to say from what I saw when I looked at your proposed legislation is I'm always looking for money. And that I saw in the legislation, if you're going to make this a statewide program, it needs more money. Because if you're looking at the amounts that are currently listed, you're basically, in my opinion, talking about making one or two counties the pilot program, and they would get the bulk of the funding, when it's not fair that we have all of the counties that have similar issues, and all of the counties are able to deal with it and are having mental health programs now that need funding. People assume that just because the law is there, the funding is there. And a lot of times the law is there and there's no funding. So I would ask you to revisit that part of your legislation because it is so vital in terms of creating stability to continue the process for when people become part of the program. Now, what we have lacking in Essex County, and I know some of the other counties don't, and we try to do it on a voluntary basis, is that once they complete our program, and they're with us for as little time of 1 year up to 2 years, is that we don't have a step-down program, or organized step-down program, that for a year after they have completed, and we don't say graduate, we say move on, because graduate terms termination. When I graduate from college, I'm not going back for classes. But if you move on, that means you can come back. And what we need is a formalized step-down program for additional services. We tell them to come back, and some do, but for additional 12 months to be in the step-down program, just to make sure that on their own, they're still able to meet whatever they need to meet to be successful in the community. Because it's about reentry into the community and about stabilization as well.
Gwen makes a very good point, we're all of us, I can speak on behalf of the chief executive there, that we're just tired of mandates that come down, mandate this, mandate that without funding. That's what we get. We get this on a regular basis, mandate that, this is mandate, this is mandate. We never get any funding. I love the idea that you're gonna provide funding for this. And I may actually suggest that perhaps probation should be somehow brought into the, because, after these folks leave, they come out of jail, their probation takes over. So they need to be at the table, and they should be included in whatever,
Yeah,
comes out of this
certainly.
bill.
No, that they were always such a huge help in our program. And I'm happy to look.
I know, we don't have unlimited resources like Jim Gannon and Bob.
If I find out.
No, these are all great proposals, and I think certainly we can look, because I'm always a huge fan of driving federal money into New Jersey, so we don't impact our taxpayers here as we try to drive down cost here. And this is just one aspect. You're exactly right. It's really, I mean, ideally, these programs would start at the first signs of a traumatic event, much like you push in if you have a traumatic event in law enforcement to the families. Because I can't tell you how many times as we were looking at the criminal history of someone, it all started about middle school with kids who had been doing pretty well until that point, and that's when they became I think the term now is justice involved, but that's when they've started experiencing their first interaction with the criminal justice system. And it almost seemed, and you know, as you're reading it, if somebody could have just interceded at one of these points, it wouldn't have got, because once you become involved with the federal criminal justice system, that is not kind of a first-time offender. That is somebody who has kind of a long criminal history. And you just see these points of inflection where someone had just been able to intervene. So you're exactly right. We'd love to walk it back, and we have several things to do that. So last but certainly not least, this was a good segue. We have Chief Caggiano here. We worked together on a range of issues. We've definitely, he was somebody who we really leaned on along with Chief Marshwitz and others on the problems with auto thefts throughout our community. And unfortunately, we've seen in auto theft specifically, criminal rings preying upon younger people, so that they can not get have the underage, be underage in the criminal system, so they don't get incarcerated. And so we've seen people as young as 12 and 14-year-olds in car theft rings and stealing cars in a really dangerous way. And so we've been trying to think of other ways, again, to engage earlier and earlier. And one of those ways is the summer youth employment bill. We know that Newark has really good summer, or some really good summer employment programs that we were sort of modeling some of this off of. But the idea that you would give young people career opportunities and then start to combat things like auto theft programs or auto theft in New Jersey, which as we've just seen, are younger and younger and younger and more dangerous. So can you tell us how, from your perspective, programs like the summer youth employment and the mental health care and reentry support system can help prevent crime and keep our community safe and support law enforcement?
Sure, absolutely. So the summer program is a great example of, so some of these kids just don't have the resources, right? And those resources, what do? They commit a crime to get those resources. So this program itself would be an opportunity to allow these kids to get, access to resources through, meaningful work and looking at going ahead and maybe developing that into a career one day. And that's a great way to start them off at a young, for us to, as government agencies to kind of get involved and try to give them that support and those resources that they need to go on a positive track. Speaking about the mental health intersection, I mean, we have, we see time and time again the same person over and over and over. And it might be that we bring them to the hospital or we connect them with services, but where's the follow-up? And that's what I love about, we're one of the agencies in Orange County that have been piloting the RIDE program. And it's one of the things that has been most beneficial for us is the follow-up that's involved. We can get them to the hospital, we can get them to services, but who's there to come back and say, are you making your appointments? Did you get in touch with that person? Have you, those are the things that we see that will help drive down the number of times we have to deal with the same person over and over. And dealing with Meg and Deanna and their team with the RIDE program has been really been a great asset for us. And it's trying to get these people involved in services long before they commit commit these crimes, or it develops to the point where now there's a domestic violence between the person who really needs help and a family member. So that's it, and I believe our officers love the program.
good.
They have been very, very open to it. They've people from MHA have been fantastic, and it's really been a positive influence for our police department. So.
Oh, that's great to hear.
So.
That's really good to hear, because it intuitively, it seems like it would be a great program, but sometimes you pass laws that sound like they make a lot of sense. So it's great to hear that this one truly is making an impact and will keep to move forward in ways and that's where I've said this to you before, you've probably heard my spiel, as have some of you in this room. We do our best work when we hear from the community and actually have people on the ground who this is going to impact and can say, hey, this is working, it's not working, this is how you can do better. Thank you, Sheriff. But thank you all for your insights. I really appreciate it. Thanks, Bob, for always bringing us together on these really important issues and conversations. As I said, this is so helpful to my advocacy and work in Washington as we're tackling these issues. And in addition to the reentry programs we focused on today, many of you who are involved in the recent launch, as we heard of the Arrive Together program with MHA, that teams law enforcement and mental health professionals to respond together to individuals in crisis in towns like Madison, Morris Plains, and Montville, represented here today. So I look forward to hearing more about how I can support you as these pilot programs evolve and grow. It sounds like that is a pilot program we want to see more people have access to. So I can't think of a better collaboration to highlight during the overlap of Mental Health Awareness Month and Police Week. And I want to end here with a big thank you to all the partners in the room for continuing to innovate and find new pathways forward. So thank you all so much. I really appreciate it.
Thank you.